Let's talk about treatment options for acute injuries such as an acute ankle sprain or acute lower back pain. Maybe you're afraid treatment in the beginning will be painful, or maybe you're worried it will be unsafe. Or you just might not even be aware that there are options for acute injuries such as an acute ankle sprain or acute lower back pain. Chiropractic care is both appropriate, safe, and beneficial for acute injuries, even in the very beginning stages when they're swollen and painful and movement is really limited. Chiropractic care can help improve circulation and reduce inflammation, reduce pain, and help you learn what you can do at home to help your injury heal. In the beginning phases of care, when the injury is still swollen or there's still a lot of muscle spasm and a lot of pain, care is going to be modified based on where your pain levels are at and where the injury is at in its healing process. Beginning phases of care can include passive modalities such as ultrasound, scraping or instrument-assisted soft tissue work, lymph drainage, and kinesiotaping. Ultrasound is a deep heat through sound waves that helps move the fluid out of the area. It can get deep into the joint and deep into the deeper muscles of the back. So this can help move fluid inside the joint of the ankle or move fluid that's deep in the lower back in those deep stabilizing muscles. Lymphatic drainage or scraping can be done lightly in the beginning when there's a lot of pain and still some swelling to help move the inflammation out of the injured area, such as the ankle, being really far away from the heart sometimes. And when you're standing, gravity is going to pull all the fluid down into the foot and ankle. So the lymph drainage with gentle scraping can be really helpful to help kind of encourage the reduction in inflammation, and that can help with pain. This can also be done on an acute low back. Again, gentle scraping can be modified and can help reduce pain and inflammation. Kinesiotape can be helpful for support of the area, either the lower back, of the ankle. This can help with things that you may need to do during your day, such as work duties, house duties, and this can help give a little extra support and help with pain in the beginning. Once you're able to move the injured area a little bit, in-office care can go over what the appropriate movements and exercises would be so that you can do home care to help reduce your pain, improve your function, and heal your injury. Here are some examples of some exercises and things you can do at home for your acute injury. Starting with gentle, active range of motion is a great way to assess how much and which movements you're able to tolerate. Starting with just up and down movements of the ankle, seeing how far you can go into the movement, and then going into the side-to-side movements, and just seeing which movements you can tolerate and if there's pain and how far it takes to come on. The star pattern lunge progression is a great way to assess your ability to push off and load the injured ankle. You go into 5 different directions: forward, 45 degrees to the side, directly to the side, 45 degrees back, and straight behind you. You can progressively increase the difficulty and intensity of the star pattern progression as you go and work your way into a full lunge, and then you can turn it into a plyometric or jumping exercise to increase your tolerance and load of that ankle. The toe raise exercise works on your loading of the muscles of the calf, the plantar flexion range of motion of the ankle, and as a single leg exercise, it works on your balance loading into that ankle. You want to make sure you keep a neutral or centered heel position, loading through all the toes, really focusing on loading through the joint of the big toe to keep that heel nice and centered so you're not rolling out towards the side, towards your pinky toe. If you are able to tolerate active range of motion on its own of the ankle without pain, then you can add a TheraBand for resistance to make the movement more challenging, Place the TheraBand around something secure and go through the same movements up towards the shin. You can do down towards the floor, going to one side, going to the other, and gauging how much resistance you can tolerate. Doing each position in a set of 10 to gauge how you feel throughout that set. Ideally, the pain, if it's there in the beginning, will decrease throughout a set of 10 reps in each position if this is helpful. The added resistance will help strengthen the muscles in the calf that go into the foot, crossing through the ankle. I hope these exercises help give you some idea of how you can manage your acute injury at home. Let me know if you have any questions. We'll see you in the next video.